Good evening. Junior doctors across the south on strike for 5 days have told ITV News Meridian enough is enough and morale is at an all-time low.
Well, this latest walkout is the longest strike in NHS history. Health Secretary Steve Barclay has warned the action will put patients at risk.
Thousands of routine appointments and procedures have had to be rescheduled. Meanwhile, figures out today show waiting lists in England are the longest they've ever been. Stacey Poole spent the day at Worthing Hospital to witness firsthand the impact of the strikes.
These doctors and nurses are under pressure like never before. 40% of the workforce are now on strike, and yet patient demand is higher than ever.
We have a really skeletal staffing service on at the moment. I feel for my colleagues, it's going to be tough.
This strike is not just about money. Doctors feel they can no longer provide the standard of care they want to.
I think as a profession, hospital doctors have got to a point whereby we have said enough is enough. We set standards, we want to achieve those standards, and that's our mantra, that's what we want to do. But if we don't have the resource and the backing to provide those standards, then we have seen standards dropping in certain areas.
No one's happy about this, and we want to see a resolution as soon as we can so that we can all get back to a normal way of working.
But a resolution feels a long way off. Doctors are calling for a 35% increase. The government has offered just 6%. And on the picket lines in Southampton, Brighton and Worthing, the overwhelming feeling was the government just isn't listening.
Unfortunately, the government has offered nothing credible to junior doctors, which will improve retention and keep young doctors in the NHS.
But today, the government were not budging. 6% is all that's being offered.
I urge all union leaders to accept these pay offers and call off their strikes.
But they're not going to accept this offer, and therefore the strikes will continue. This 5-day strike by junior doctors will undoubtedly have a huge impact on patient care. But just as it ends, consultants will then walk out for 2 days, followed by radiographers, and that will have an impact on cancer care.
Each time we have a round of industrial action, it's patients that suffer. You know, patients aren't getting access to their operations or their outpatient appointments, and we know that we've got far too many patients waiting far too long just now, so this is making it much harder to get back to the standards of care that we all want to deliver for our patients.
In this strike, nobody will win. Patient care will suffer, doctors and nurses will have to work even harder, and waiting lists will grow even longer. And so everyone in the NHS is calling on the government to follow the Scottish example and find a resolution to these strikes.
The NHS is an absolute golden thread in this country, and we need to protect it and look after it. But to do that, we need to protect and look after our patients and our staff. And that's why we want to seek a resolution to the current situation that we're in.
And until that happens, sadly, it's the patients who will pay the ultimate price. Stacey Poole, ITV News in Worthing.